Now, where do these things come from? You know, did somebody just dream this up one night or what? But what we're going to do is we're going to go into some of the causes of subluxation right now. And it'll be kind of interesting to see where you all kind of fit into there. Maybe you might be in one or two of these little categories. So let's look at that. The different causes of subluxations. Again, a subluxation is a interference to function that causes a lack of health. What are some of the causes? First of all, a stress to which the body has not adapted, especially physical, chemical, or emotional stress. And I like to put a big old capital E here and highlight it. Emotional stress is probably one of the biggest factors for causing subluxations that there is. I can tell you, you know, back when I was in school, they always told us that probably the #1 cause of subluxation was physical trauma, a fall, an accident, something of that nature. Now, statistically, that still might be true, but I can tell you in over 10 years of practice, this is a close second. This is right behind it, okay? An unnatural lifestyle, that's self-explanatory. Exertion and fatigue will lead to subluxations. Air, water, and food pollution cause subluxations in your spine. Geez, Doc, how can that be? Okay, let's go. Here we go. Now you're going to start thinking. We're going to start cooking a little bit. Air pollution. First of all, let me ask you, who ever flew into Newark Airport before? Did you see what you're flying into?
Smog.
Well, we breathe that stuff all day long. You know, God, how do people live on Route 1 over there? You know, I have no idea, but, okay? The air that we breathe, the water that we drink. You ever do any plumbing around your house? Okay? I don't even care if you've got a water softener or not. You see how hard the water is? What happens to the inside of those pipes? What do you think happens to the pipes inside here? Okay? But the air that you breathe, the water that you drink, the food that you eat. I mean, garbage. All right? Scooter pies. Garbage. You know, let's take a look at this. First of all the additives, you know, the BHT, the monosodium glutamate, the red dye number 2, that is junk. That's doing absolutely nothing to enhance your health. If anything, it's going to rob your body of vitamins. Probably one of the biggest culprits is sugar. We're all sugar addicts over here. Do you ever pick up a package and you look at a package, you know, things are supposed to be listed from greatest quantity to least quantity. Guess where sugar is? It's usually in the top 4 or something. And sugar disguises itself under different names too. You should be aware of that. Anytime a word ends in os, O-S-E, it's a sugar. So sucrose, fructose, galactose, maltose, glucose, sugar. Modified corn sweetener, you know what that is? Sugar. You know, you pick up a box of cereal, that's 3/4 of that is junky sugar. Okay? We eat bleached flour, you know, bleached flour, we make Wonder Bread. Wonder Bread's wonderful for nobody. I don't want to even give that to the birds, okay? Bleached flour is total junk. You should be getting fiber in your diet, all right? You should be putting some kind of, you know, bran in there or some kind of whole wheat. But let's take a look at that. You know, we take all of this garbage that allows the air that we breathe, the water that we drink that's polluted, the food that we eat, which is pure non-nutritional junk. And what happens is this stuff all interreacts and forms what's called a neurochemical reaction. What that is a chemical reaction that affects your central nervous system. And guess what it leads to? Subluxations. Okay, so you got to kind of watch what you put in there. Those of you who are patients, in a little booklet that we gave you when you came in here, there's some little guidelines in the back, just general nutritional health principles which you should try to follow, okay? And I think that would help you out a lot. Hereditary factors, genetics cause subluxations. You know, I make no bones about it, no apologies. We run a family practice. Those of you who are patients, you know, you see the kids, they're running all over the place here, right? Well, hereditary factors, genes have a lot to do with subluxations. The reason? Simple. Kids will inherit spinal weaknesses from who? Mom and dad or grandma and grandpa. So guess what? If they don't get their spines checked and corrected, they're liable to wind up with the same kind of problems down the road as who? Mom and dad and grandma and grandpa. Okay? Again, I can't overemphasize the importance of kids being checked. Genetics definitely plays a role in subluxations. Anger, irritation, conflict, slips, jerks, jolts, contact sports, falls, accidents, jars, horseplay. Think about the kids again. Look at the kid in an average day. What does a kid do? Okay? It's amazing they're alive. You know, Jimmy fell off the swing, Billy had a fight with Tommy, Mary fell off her bicycle. These kids are falling all the time, you know? And does mom ever stop to think that maybe, you know, Mary had a subluxation? In fact, I'll give you an analogy. You know what happens here? Mary was riding her bike and she fell off. So she comes crying into the house to Mommy. Mommy, I have a boo-boo. The kid's maybe got a knee scraped up, whatever. So Mommy gives her a little first aid and some tender loving care and gives her a lollipop and a little affection. And pretty soon, everybody's happy, you know, and Mary goes back outside to play. Now she's happy because she got some attention and, you know, she got a lollipop or whatever. Mom's happy, the kid shut up. And life goes on, all right? But what happens? Does Mom ever stop and think, geez, I wonder if that fall caused a subluxation in Mary's spine? Mom probably never even heard of a subluxation before. But what the scenario goes like this. Mary had a subluxation from a fall off the bike. Well, the subluxation stays present, and after a period of time, all of a sudden her body just can't cope with this thing too well. Now all of a sudden Mary starts getting colds all the time and a runny nose all the time. She never had that before. And then time goes on a little bit more and she starts getting fevers all the time. And geez, she never had that. And the next thing you know, her tonsils are inflamed constantly and she's getting ear infections all the time. Geez, Doc, what happened? And we can simply trace that back to that fall off the bicycle that caused the subluxation, that caused Mary's little body just not to work right. All right? Again, I can't overemphasize the importance of getting the kid's spine checked. And there's no age limit to chiropractic care, by the way. If you're living, if you've got a spine, if you've got a subluxation, you're a chiropractic case. That's it, pure and simple. All right? You adjust an infant completely different from how you would adjust a young adult, which is different than how you would adjust somebody who's a senior citizen. Okay? Everybody's done differently, but the importance is to get them checked. Improper postures as a cause of subluxation. I like this one. I like to look at the audience and see what I'm looking at. I'm going to turn for a second and make believe like I don't see what I'm saying here. Okay. Yeah, you remember when you were back in school, at least the school I came from, the nuns used to like to wrap you on the knuckles because you were slouching in your chair all the time and all of that, right? Well, actually they were doing you a favor. Everybody, adults and kids, but especially the kids, should be sitting with their backs straight up against the chair and their feet flat on the floor. I'll show you why. You have to understand something, that a child's bony system, their osseous system, does not fully solidify and harden until they're between 19 to 25 years of age. So what does that mean? First of all, if a kid's constantly slouching in the chair all of the time, it's going to mean there's a lot of undue pressure put onto the child's spine, which is going to lead to, number one, subluxations. Number two, they can wind up with postural problems like a scoliosis, a curve in the spine, from improper postures. So everybody, feet flat on the floor, your back straight up against the back of the chair. Okay? Good. Now, while I'm on that topic, people come in here and they get adjusted. They come in here, they've got low back subluxations and they got all kinds of problems. And so we go and we adjust them. And right after I adjust them, they sit down and they do what? No?
Cross their legs.
Bingo. Don't cross your legs. Say it. Come on, say it. Don't cross your legs. Good. Now, I'm going to tell you why I did that. What we just did is we put in your mind now, we just embedded that into your conscious mind, that thing, so that the next time you go to sit down and you start to cross this, you're going to hear DaCosta's horny voice yelling at you not to do it. And I'm going to show you the reason why. Let's say this is your right hip, right here, and you decide you're going to cross your right leg. First of all, you're going to abduct this hip out. You're going to bring it out this way. Now you're sitting, so you're in a weight-bearing position. So you're just going to have this sacrum come right down on this side and shear this thing right down. Do you know what you're doing to the sacroiliac joint right here? You're just saying, come on, baby, go right out of place. All right? Don't cross your legs, all right? Just remember that. Don't cross your legs. And you're going to start saving yourself a load of trouble. That's real important. Ladies, if you want to cheat, you can cross at the ankles. That's it. Okay? You're welcome. All right. Now, speaking of improper physical postures, and ladies, you know, heels, try to keep out of them as much as possible. Remember platform shoes? Remember when they were in? That was a chiropractor's dream. It was, because everybody was coming in with low back subluxations. Well, no wonder. They're 3 feet off the ground. Their pelvises are all rocked forward, and they're putting all kinds of strain into their lower back, getting subluxated. And they came in there and said, geez, doctor, I have this problem. Okay, well, I got news for you. Heels are going to do the same thing for you. They're going to rotate your pelvis, and they're going to cause subluxations in your lower back. So, you know, just try to be conscientious about it. I'm not saying go to a formal affair and sneakers or something. But okay, just keep out of those as much as possible. Stay in the flats. The flats will be the best thing for you. Stay out of the heels. Guys, wallets in the back pocket. Who's got their wallet in the back pocket? Yank them out of there. Okay? Ladies, you know, because you do their pants half the time. Some of these guys, you know, they got wads this big here.
Oh, I know.
And they got burr holes in the back pockets. They're ripping right through, and the wallets are hanging out there. Listen to what happens. You know, those wallets, when they're this thick, you sit down on those things. You know what happens? They act like a wedge. They literally wedge your pelvis, and they prop it up like this. They put sufficient stress in your lower back to cause subluxations. In fact, there's a whole thing called wallet sciatic syndrome, where people get sciatic pain down the leg because of these wallets compressing the sciatic nerve. All right? So no wallets in the back pocket when you're sitting. I mean, you could walk around or whatever, that's fine. But don't sit with a wallet in your back pocket. That's really bad news. Okay.